This discussion on symptoms is very necessary. Some of you have been here 10 visits. Some of you have been here just a few more than that, 10 to 15 visits. Now there's one or two things happening. Number one, you don't have any symptoms. You're saying to yourself, wow, I feel pretty good. What am I coming in here for? It doesn't make any sense to me. It's not logical that I came in with a variety of symptoms or whatever it may have been and it's gone. Why do I keep coming in? Well, let me explain to you why I keep coming in. The reason for it being is if we were to take an x-ray, which we will if you wish, be able to compare that x-ray with the one we took initially, you'd find essentially the same thing because we haven't corrected that bone that's out of alignment that we called subluxation, if you recall. So we still have squeezing pressures on the brainstem and on the nerves, but you don't have any symptoms. The reason you don't have a symptom is twofold. Number one, if you move a bone just about the width of one of your hairs off of the nerve, that's enough to stop the signal. It's enough to stop the symptom. So relatively, you'd be able to say, hey, I don't have the symptom. I am well. I don't need to come in. But that's wrong. Now, if you realize this, that as the tissue cells are being replaced, as they come into a normal relationship, they're not sending adverse information to the brain. So therefore, the brain isn't reacting to do the healing, and you are relatively asymptomatic. And you must understand that's not the reason you came in here. We told you initially we're not here to treat your symptoms or your diseases. We told you we're here to correct that bone that's squeezing on the brainstem, and that still stands. Now conversely, maybe you've come in here 10 or 15 times and you still have symptoms. And you're saying to yourself, what in God's name? I've been here 15 times, I still have the symptoms. I don't think that you're helping me. That's wrong too. Because again, if we were to take now and realize this, if in fact we've had a lot of pressure on the brain stem and the spinal cord, two things happen. Number one, because of the position of the bone coming back into the covering on the brain stem and the spinal cord, you can get a callus formation, like calluses that you get on your hand, that could still be causing pressure back there on the nerve, causing you to have symptoms, number one. Number two, you didn't get symptoms until you had enough abnormal cells. So let's say one cell became 1,000,000 cells, then 5 trillion cells, all of them dysfunctional and abnormal, bang, you got the symptom. It's been about 3 weeks or 4 weeks we've been adjusting you. We haven't had time really for the body to replace those abnormal cells with normal cells, so you could still be getting symptoms. That should make sense to you. So what I want you to realize, you could be without symptoms, still need care. You can be with symptoms and be getting better, because the symptoms don't indicate whether or not the bone is out of alignment or not. If in fact we could go out here and x-ray 100,000 people, out of that 100,000 people we find 80% of those people with a bone out of alignment, and yet they have no symptoms. Or they may have some indications. Occasionally they get stiff, occasionally they get headaches, indigestion, a variety of things that the body's trying to tell them that something is wrong. But normally what we do is pop a pill, take a potion, or rub on a lotion, or do something from the outside in to make us feel better. That's not the answer. The answer is to be able to have the body function the way it's supposed to function, from above, down, inside, out.